Thank you so much for joining us today. Today, we're really happy to be here to talk to you and discuss with you how the role of the nurses in helping to secure public coverage for medications in Canada, really how nurses can help share the real-life impact of treatment. Like to introduce ourselves today. Today we have two presentation partners, myself, Christina Sit. I am the Manager of Community and Strategic Partnerships at LLSC, and Colleen McMillan, my partner in crime, who is the Advocacy Lead at the Leukemia Lymphoma Society of Canada as well. And our mission at LLSC is really to cure leukemia, lymphoma, Hodgkin's disease, myeloma, and improve the quality of patient life for patients and their families. Really, we want to cure blood cancer. Today, you are joining us by this continuing education platform. I just want to remind you that there is certification available for nurses in Quebec, and there are many different training modules that are available. We have new training that is added every month. And then we also have resources that are available to download and print on our website that you can share with your patients to use as teaching tools. So today's objectives really want to provide you with an outline of the process used to evaluate treatments. That process in Canada is called Health Technology Assessment for public coverage in Canada. We want to present the value of your voice, of the nurse's clinical experience in health technology assessment, and then really outline a pathway for you to participate in this health technology assessment process so that we can get public coverage for treatments to get the right treatments to the right patients at the right time. And you might be asking yourself, why do we need the nurse voice? Well, it's really all encapsulated in this. Nelarabine for pediatric ALL. This was a treatment that was approved by Health Canada about 6,000 days ago. 6,000. There were 6,000 days between Health Canada approval and then the decision made and a recommendation made, yes, we need to publicly cover that drug. 15 years. And so our public reimbursement bodies that make these decisions are currently looking for that balance. What is the balance of the value versus the price? And how do we achieve that balance? And so this is where the voices of the nurses can come in very effectively. You know, all of you are very used to seeing traditional study results like these percentages, these values, and the confidence intervals. But nurses don't just see data. Nurses see the people behind the data. And that is the value that we want, that nurses can share with the assessment bodies. They take the traditional study results, and yes, you really understand the median time response for 5 weeks, but you know that it works relatively fast. Your clinical experience is telling you that this means that patients are able to gain movement, or they're able to gain things like functionality, meaningful real-life responses. You see the line that says corticosteroid doses reduced in 65% of the patients, but you know what it means. You know it means the reduction in roid rage. You know that improves sleep and function. So that is the opportunity. That is the opportunity within the traditional health technology framework for nurses to present some of this real life information in front of these bodies. And so before I go into to illustrate an example of that opportunity, I'm going to share with you what drug access and those reimbursement bodies look like in Canada right now. So as a reminder, Health Canada is the body that provides approval for the drugs. But what they look at is, does it work and is it safe? So then the next body is CADTH, Canadian Agency for Drugs and Technology in Health, and in Quebec, INES. These are the bodies within the health technology assessment process that looks at, yes, it works, but is it of value? And does it work well enough to be covered by public funding? If they make a recommendation to say, yes, we believe it can be publicly funded, then the next step is the pricing negotiation, which is taken over by the Pan-Canadian Pharmaceutical Alliance. After those pricing negotiations are complete, then they are passed over to the individual provinces and ministries of health and cancer agencies to determine when their provinces will cover this treatment. And it is in the opportunity is in CADTH. This is where they're inviting input from patient organizations as well as clinicians. And why is the nurse viewpoint so important? It's all rooted in this deliberative framework. CADTH has a deliberative framework that's based on 4 quadrants. One is the clinical benefit, the study data and how the study data is effective. The second quadrant is patient-based values. The third bucket is the economic evaluation. How much does it cost? And the fourth one is adoption feasibility. What would it take to put this drug into our hospital system, and how does it work in real life? As you can see, nurses really can provide insight into the clinical benefit, patient-based values, adoption feasibility, and really even talk about what is that value in terms and push some of these costs, these values beyond just the price of the drug in front of the CADTH deliberative committee. These are some of the questions that they ask. They ask us about the advantages and disadvantages that impact on patient lives, impact on caregiver lives, and how does it compare to previous therapy? These are some of the questions that are then asked of the clinicians. And you can see here some of these, definitely these questions are very much things that nursing can provide a very specific insight into. The convenience, the compliance, the tolerance, what is available, how some of these unmet needs, and maybe even shed some insight into unmet needs that are not even asked here by CADTH. They ask, when it talks about the treatment that they're considering public coverage for, they really talk about clinically meaningful responses. They talk about how it works in real life versus the clinical trials. So you can see here, definitely, these are things that nurses have tremendous insight into. So I'm going to turn it over to my partner here, Colleen, who's going to talk about our LLSC process for CADTH patient group submissions.
Hi, everyone. I'm here to talk to you today about LLSC's HTA participation and shine a light on how we use real-life patient experience to as a part of our HTA submissions. LLSC has participated in HTA submissions for 6 different treatments so far in 2023. These included treatments for pediatric T-cell ALL, a pre-allogenic stem cell transplant conditioning treatment, treatments for ALL and graft versus host disease, COVID-19 progression and protection, and treatment for large B-cell lymphoma, including DLBCL. LLSC's patient group input submission for belumosudil for chronic GVHD. The LLSC methodology for all HTA submissions is to explore and relay information such as, what do patients value and what is the impact? We gather this information through interviews and surveys. In the case of belumosudil, we conducted interviews with those who have had experience with chronic GVHD in order to try to find the common themes among their experiences. We then use these themes to develop our patient survey. The patient responses to our survey were then used to create our patient group input submission. Within this submission, we went above and beyond the data and translated the data into real-life patient experience. We knew that according to data from the Rockstar study of belumosudil for chronic GVHD, after receiving treatment, some belumosudil users had a reduced need for steroids and other immunosuppressants. But the study results didn't speak to how this reduction in steroids really affected patients' daily lives. Our team conducted in-depth interviews with people who have had experience with chronic GVHD in order to get a better idea of how or if belumosudil could potentially meet currently unmet day-to-day needs of patients. Their experiences and side effects varied dramatically, but a common theme was the burden of side effects experienced by those receiving the standard first-line systemic therapy for chronic GVHD, corticosteroid treatment. The results of our survey validated the qualitative themes from our interviews and quantified the real-life experience of chronic GVHD. Results demonstrated the impact of chronic GVHD on various aspects of the lives of patients and their loved ones. When developing our belumosudil survey, we wanted to relay the patient experience in an all-encompassing way. Our survey included questions about how chronic GVHD affected patients and caregivers' ability to continue with school or work, what the impact was on patients' ability to be independent and maintain self-care, and what the impacts were of continued steroid use. Our submission. Disease experience. Even a slight case of GVHD can make a notable difference in the everyday lives of patients and caregivers, and both have to make lifestyle changes in order to manage the burden brought on by GVHD. One respondent declared, "It impacts so much." Another respondent said, "It broke my life, professional, social, financial, parental. As much mentally as physically, I will never be the same." This respondent was 54 years old and learned the bad news at 47 years old. The powerlessness that patients experience throughout GVHD can be unbearable. Some patients relayed that there were times when they were unable to see or had extreme eye dryness and pain, or were unable to eat because GVHD filled their mouth with sores and ulcers. One patient stated that since graft versus host disease, they could not read or use a screen for more than 30 minutes. Nowadays, what job doesn't use a screen? They also relayed that they cannot drive for more than 40 minutes. Experiences with currently available treatments. 74% of our respondents stated that they have experienced aggression, agitation, irritability, or mood changes as a result of steroid treatment. Some even describe it as roid rage. Depression, sadness, and suicidal thoughts are also concerning side effects of steroid treatment. There are also many physical side effects that affect patients' day-to-day lives, relationships, and self-image, including weight gain or loss, headaches, trouble sleeping, thinking, speaking, and walking. One respondent noted, being on prednisone was a horrible experience and that the physical symptoms left him unrecognizable to himself and his family. He continues that once he was able to get off of steroids, his health dramatically improved, and stated, "I can't emphasize the impact enough, really." Experience with the drug under review. Belumosudil is a new treatment in Canada, and as a result, CADTH is aware that there is limited patient experience to investigate. 3 of our respondents had experience with the treatment and provided significant responses. All 3 respondents relayed that their steroid dosage was able to be reduced as a result of their treatment with belumosudil. This is highly significant to patient well-being. A reduction in steroid dosage was a relief for patients and was beneficial to the patient's quality of life. 100% of our 3 out of 3 respondents stated that belumosudil treatment had a positive impact on their home life and personal life in comparison to before treatment. One patient commented that discontinuing steroids brought him back to the person he was before he got sick, and that gradually losing his Cushingoid appearance dramatically improved his mental health.
Thank you so much, Colleen. And you can see with this belumosudil case study, what we've been doing is really pulling out themes that are not captured in clinical trial. What was the real life impact of the unmet need? And really, that was something that we noted. The real life input of steroid uses was not clearly or adequately portrayed. So that's what we focused in on our CADTH submission. When we talked about the impact of the treatment, we really focused in again on things that the clinical trial didn't necessarily measure. And so that is why nurses could have a significant impact. Within this case study, if we had nurses' impact put into this submission, nurses really could have their clinical observations. You could talk about the functionality, the movement, what it is that is really impacting the lives of the patients. Things like independence and outlook. And, nurses, because of their scientific training and are really able to marry those clinical outcomes with people-centered outcomes. And my aunt, who used to be a pediatric ICU nurse, she keeps telling me with nursing, there is the science of nursing, and then there is the art of nursing. And so those are things that absolutely can be presented within a nurse's input. CADTH is not looking for a rehash of the clinical data. They have the paper for that. What they want to know is all the real stuff, all the stuff that people tell nurses. And so how can nurses be involved? You know, we encourage you to really connect to the LLSC. Our emails are listed here on the slide, and we will send you opportunities, but we only want you to respond and to the questions or submissions that you're comfortable with. You could share your thoughts on email and through a one-on-one interview or a focus group if you like, and review the draft submission and then give us consent to add your voice. We are here to make it as easy for you as possible. So I want to thank AbbVie, because this video was made possible due to the support of AbbVie Canada. And I want to remind you that as you are going, as you're in front of your patients, and LLSC has a number of resources that really can help. We have a care pad that lists all our resources out and gives you a phone number so that your patients can call to get connected to our community service leads. So thank you so much for your time today. We really appreciate you giving us your time, and we hope together that we can never have a 6,000-day gap again. Thank you.